Hello and welcome to the Oral Health Podcast. In connection with National Smile Month, we are here bringing you bite-sized discussions with different leaders in dentistry on oral health on a variety of topics. Today, we are looking at systemic diseases, which sounds scary, but that just means they are conditions that affect the body as a whole. And this episode of the Oral Health Podcast is sponsored by Oral-B. Dr. Angela is here again to discuss all things systemic diseases and oral health. Angela, how are you?
I'm really well. Thank you so much for having me on again. It's lovely to join you to talk about this.
Yeah, we love having you, Angela. We love having you. It's always good. So we'll just dive straight in because there is an awful lot within this to unpack. So I think to start off, just hammering in that letting oral health care routines slip, it affects more than just our mouths. There's been a lot of studies over quite a while that suggests that things like gum disease is actually linked to a lot of conditions. Do you want to just kick us off and unpack that a little bit?
Yeah, so as you said, there have been thought to be associations with gum disease and other health conditions for a long time. And there have been quite a few studies investigating the link between gum disease and certain conditions. One that we do know quite well is the link of gum disease and diabetes. So there's been lots of evidence that has shown that people with severe gum disease, it can affect their kind of diabetic control. So if you have really bad gum disease, it can affect your complications with diabetes. Also, the severity of gum disease also affects the severity of your diabetic complications. So it's really worth kind of keeping on top of your gum health if you are diabetic. And it's one of the kind of things that we screen for as well when we're doing your dental examinations to check if you have any other risk factors like diabetes when we're checking for your gums. Another association has been with heart disease. So that's one that's kind of been studied quite a lot as well. So there's been thought that gum disease can affect our risk of certain conditions like stroke, heart attack. So that's really important to kind of bear in mind if you have gum disease and if you also have any other risk factors. There have been loads of studies about other disorders because basically gum disease is like a chronic inflammatory disease. So it's inflammation in the mouth, and potentially that could spread to other areas in the body and affect other systems in the body. So there have been things that are looked at like in pregnancy and whether that affects the birth weight, like with low birth weight and with premature births. Although the evidence is not too strong with that. So even though the evidence is not too strong, it's still really worth looking after your gums to prevent that kind of pregnancy outcomes. When you are pregnant as well, that can also affect the gums. So when you're pregnant, there's changes in the hormones and you can get more gum tenderness or gum inflammation. So it's still really important to see a dentist and hygienist during pregnancy. So don't avoid that. And there's other conditions that they've looked into as well, like breathing conditions like COPD, arthritis, loads of things that they've looked into. Now, a lot of these conditions kind of be interlinked, so they can't say for sure if the gum disease is causing those conditions or the other way around. So sometimes it's just like multiple factors coming into play. So often people who have diabetes may also have heart conditions, may also have gum disease. So it's one of those things, it's hard to say what's causing what. Also, smoking is a really big risk factor for gum disease. So obviously smoking can affect other systems in the body like your lungs, so there's thought to be some link there. So it's kind of giving advice on gum disease. We always recommend you to stop smoking because not only will it benefit your gums but also your general health as well. So the system's all very interlinked, but we don't fully know what's causing what in some cases, but we do know the strong link between diabetes, heart disease and gum disease.
It's like it sounds a bit like a chicken and the egg situation. If you have a condition like a heart condition or you're diabetic, you've probably already been told by like a cardiologist or a GP, make sure you brush your teeth, make sure you clean your gums. That was definitely the case. When I used to go and see heart doctors, they would always say, brush your teeth. And I just sort of went, yeah, all right, and didn't really question it. But actually, like I say, it's linked to so much that it's such a simple thing. Like flossing could help stop you having a heart attack, could help stop you having a stroke. Why wouldn't you do it? Like, it makes sense when you put it like that, but I think sometimes it might get a little bit lost on just how important it can be.
Yeah, I mean, the oral health is so important for just your general health. It affects your health and well-being so much, and sometimes people forget that the mouth is linked to the body. So, looking after your oral health, you're in turn going to be looking after your general health. So yeah, it's really important. And in terms, when you mentioned about the heart conditions as well, one of the ways that affects the heart is that when they have dental issues, if you have like leaky gums, the bacteria can enter the bloodstream that way and could potentially affect the heart in that way. So there are some conditions, developmental conditions, that then they have to really look after their oral health. The cardiovascular diseases, that's like stroke and heart attacks. As I said, we don't know in what way it affects the heart, but it's still worth really looking after your oral health, because we do know that things are linked, but we don't know, how much.
Yeah, I mean, to be honest with you, knowing that they're linked should be enough to make you go, I need to look after my teeth. Like, just knowing that there's a link there, it shouldn't, to the average Joe, obviously to dental professionals, it's a little bit different, but to the average person, to go, there's a link between this and that, so I need to do this to stop that. It should be enough to say, right, okay, I'm going to do it. Maybe don't need to necessarily understand the nuances of the human body because you haven't been to medical school. Like, it's a very, very complex set of intricacies, and I mean, I don't know another way to put it. Like, it is just so intricate, the human body, that everything is connected. And I think people sometimes think, oh, I don't know why I'm gesturing because we're on a podcast, but from chin to nose doesn't matter. It doesn't affect the rest of the body, and that's just not true.
Yeah, I mean, there's lots of signs in the mouth that we see that can give us clues to other things going on in the body. So yeah, your mouth can affect other systems in the body in that way as well.
Definitely. One thing just before we move on slightly, talking about conditions that gum health can be linked to, and severity of COVID cases. And there has been some studies that have shown that gum disease can increase the severity of symptoms of the coronavirus. And that's something that I've seen circulated around a lot. It's probably worth just addressing that a little bit and say that there's not enough research to say that if you've got gum disease, you're going to get coronavirus, and that's not the case at all.
Yeah, so the study's shown that people who had severe gum disease, poorer outcomes if they did get COVID. But because we don't know if that's because, we don't know for sure if that's caused by the gum disease, or if it's because these people who have gum disease also have other comorbidities. So they may also suffer from diabetes, they may also have heart disease, they may also have obesity, and they could be older as well. So it could be linked, but it's not to say that if you had COVID and you have gum disease, you're going to have like a poor outcome. It's just something to bear in mind, and another reason why we should be looking after our oral health, because that's one thing that we can prevent. A lot of things we can't prevent, no matter how careful you are. You may still contract it, COVID. But with gum disease, it's something that we know that we can control, with good oral hygiene, with stopping smoking, and visiting the dentist regularly. I think that's something that we can help prevent.
Definitely. A very, very well put. When we like the risk factors of things like gum disease and systemic conditions, I've got here things like age, sex, like obesity or being overweight. But there's also things like socioeconomic status and conditions, like diabetes. What do you think of those risk factors of like age, sex? How much does that play a part in something like gum disease?
So with gum disease, we do see it more in older people. We do see it more in people with lower socioeconomic status, in people who smoke. Actually, I'll come back to the smoking, but we do see it more, but it doesn't mean that if you have those risk factors, you will get gum disease. With the smoking, that is really well linked to gum disease, and in terms of gum disease treatment as well, if you continue to smoke, the improvement that you get is going to be not as good. So it's going to be more difficult for your body to heal after gum disease treatment. So, I mean, smoking is one thing that's linked to loads of other conditions. So if you can stop smoking, I would highly recommend that. But obesity can be linked to a poor diet, high sugar diets. That can be linked to more plaque in the mouth, dental decay, gum disease. So there's all those factors coming in play. Age, as I said, we have our teeth in the mouth for a long time. They're exposed to more attacks from sugar and from acid. So that can be a reason why people have more gum disease as you get older. But we do see people, as you mentioned, who have perfectly healthy teeth in their 90s. So it doesn't mean that you will get it. It is a risk factor because, we do see it more as you get older, but it can be prevented.
Mm-hmm. Yeah, it's all preventable. And, if you catch gum disease early as well, it can be reversed, can't it?
Very early stages of gum disease can be reversed. So when it's called gingivitis, that's inflammation of just the gum tissue. So that's the soft tissue that supports the tooth. That's reversible, but when the bacterial toxins affects the supporting structures like the bone, that's unfortunately not reversible. So that's why we need to prevent it from developing into actual gum disease, which unfortunately isn't reversible. But with good oral hygiene and prevention, we can prevent it from worsening. So we can still hold on to the teeth even if you get gum disease, we can still hold on to your teeth for life if we kind of catch it early and do all we can to prevent it getting worse.
So even if it's not reversible, it's manageable.
It's manageable, yeah. It's one of those things that once you do have gum disease, you'll never fully get rid of it. So it won't ever go away. It's something you have to keep on top of all the time. It's not just you'll see the hygienist once and they'll cure it.
Yeah.
You'll have to, it's the home hygiene that makes the biggest difference actually with gum disease. So that's why the brushing and flossing and the diet is so important, and other lifestyle factors like smoking. That's so important because what we do in the clinic, it will help, but the most of the improvement with gum disease is going to be from your home care routine.
Yeah, absolutely. Because at the end of the day, when you go and see a hygienist or a dentist, they do what they can, but they're not their teeth. They're going to send you home. And they can't come to your house and brush your teeth for you. You've got to take some ownership.
Exactly.
If say, someone is diabetic, is there anything that they need to do differently to make sure that they don't develop any symptoms of gum conditions? Or is it just a case of being more vigilant?
Well, even their diabetic control, they need to keep on top of their diabetic control, because if your diabetes isn't controlled and you get gum disease, then that can make the gum disease worse as well. So that's important to get that under control. And then also just attending dentists regularly to get them checked regularly, following the advice that the dentist or the hygienist gives. Or if you take insulin, keeping that under control as well.
Yeah. Is there anything else that maybe, because we're talking about systemic conditions, that we need to bear in mind?
Yeah, there have been some studies to suggest that there's some link between gum disease and Alzheimer's. So again, more studies are needed, but that's thought to be to do with the chronic inflammation from gum disease. So there can be lots of links that we do still need more evidence for, but it's just another reason to keep on top of your oral hygiene. If there was a causative link, then we can prevent that.
Brilliant. Well, that has been a very enlightening episode today. I think I've learned a lot. I hope that you've learned a lot as well listening. We've really loved having you on the podcast, Angela. It's been fantastic. Really, really, really pleased that you were able to spare some time to sit and talk to me and do this, because I feel like we're all going out of it having learnt something, which is just the best thing that we can hope for from this.
Oh, I'm so glad that you've learned something, and I'm so pleased that you asked me to do this.
Yeah, it's been fab. And join us next time, where we will have a different guest and we'll be discussing a different oral health topic. So until then, goodbye.